Hi everyone. I just wanted to make a video talking a little bit about why we require medical records for new patients when they come in and see us. The number one reason is that we do not offer diagnostics here. We do not have the ability to take x-rays or in-house lab work or really anything like that. We don't have the ability to sedate our patients. And because a lot of the times it's just me in the exam room with the owner and the patient, we don't have the ability to restrain them appropriately that we would need to for a full orthopedic or neurologic exam. So we require that those testing be done at their primary veterinarian prior to coming to us so that we can just confirm that diagnosis when we get here by reviewing the medical record or by doing a brief exam on the area that is being seen for. But it's very difficult for us to diagnose a patient. The other thing too is that sometimes clients mishear or there's some miscommunication between the primary veterinarian and then when they call us and tell us what is going on. So for example, recently we received a phone call from a potentially new client who said that their dog was having some hip issues and they wanted to get their patient in to be seen for that. And once we reviewed the medical record, it actually was the stifle or the knee. It wasn't the hip. And it just makes sure that we are on the right foot moving forward as soon as the patient comes in the door. We're not waiting to try and figure out what's going on. We can just hit the ground running. The third reason is that sometimes maybe something isn't communicated to the primary veterinarian, but when the clients call us, that is communicated to us. And once I review the medical records, I can call and confirm or talk to the primary veterinarian about what's going on, and maybe we decide that more diagnostics need to be done. Another example of that was a patient that was referred to me. The primary veterinarian and I spoke at length about it, and we decided that it probably was best for an orthopedic surgeon to get involved instead of coming here for acupuncture first. And turns out that that patient unfortunately had an aggressive form of cancer that the acupuncture actually could have potentially made worse. So those are different reasons why we require medical records to be reviewed and sent over from your primary veterinarian and then also reviewed before we make an initial consultation. I hope that clears up some of the misconceptions as to why we do that. And if you have further questions, please give the office a call or send us an email and we'd be happy to clear it up any particular questions that you might have. Thank you so much.